Ready to dive deep into antidepressants?
Always.
It looks like you sent us a lot on Zytomil.
Oh, yeah.
That's Escitalopram.
Mm-hmm.
We're going to look for key facts and safety info and just what to watch out for.
Yeah.
We've got a patient information leaflet
Okay.
and a medication briefing document for Zytomil.
All right.
So this is your deep dive shortcut.
Well, Zytomil is, it's classified as an SSRI,
Okay.
selective serotonin reuptake inhibitor,
Mm-hmm.
and it works by increasing serotonin levels in the brain.
Right.
Serotonin is often called a mood messenger
Yeah, I saw that in the sources.
because it really helps regulate feelings of well-being and happiness.
But it's not just for, just feeling blue, right?
Right.
The sources list major depression, panic disorder, even panic disorder with agoraphobia,
Yeah.
fear of open spaces,
Yeah.
social anxiety, generalized anxiety, and OCD.
Right.
That's a lot.
It is. And speaking of social anxiety, you mentioned that's something that you're dealing with. Research suggests that Zytomil might be especially helpful for those physical symptoms, like a racing heart, rather than just those worrying thoughts.
That is interesting. How can one little pill do so much?
Right.
But with all medications, there are some serious warnings about who should not take Zytomil.
Absolutely. And there are very specific contraindications
Oh, yeah.
listed in the sources.
Okay.
For instance, if you're allergic to Escitalopram
Right.
or any of the inactive ingredients in Zytomil,
Yeah.
this medication is off the table.
And here's one that really stood out to me. Anyone under 18 years old.
Oh, for sure.
The sources are very clear about the risks outweighing the benefits in this age group.
Yeah, the research on the effects of Zytomil on developing brains is still ongoing.
Mm-hmm.
And the leaflet specifically notes that young people are at a higher risk for serious side effects,
Right.
like suicidal thoughts.
Wow, that's definitely something to keep in mind.
Yeah.
What about people taking other medications?
Oh, yeah.
I know the sources mentioned something about that.
Drug interactions are a big concern.
Okay.
For example, Zytomil shouldn't be mixed with MAOIs, which are often prescribed for depression and Parkinson's disease.
Mm-hmm.
Combining them could have dangerous consequences.
So if you're switching from an MAOI to Zytomil, you'd need a break between the two?
Precisely.
Right.
Your doctor would likely recommend at least a 2-week gap.
Okay.
The sources also list pregnant or breastfeeding women and individuals with certain pre-existing conditions, like heart rhythm abnormalities, as folks who shouldn't take Zytomil.
Okay. So it's definitely not a casual over-the-counter medication.
Right.
There's a lot to consider before even thinking about taking Zytomil.
A doctor's guidance is absolutely essential.
And what about people who can take it? Are there still precautions they need to be aware of?
Even if Zytomil is deemed appropriate, potential risks still need careful consideration.
The sources mention suicidal thoughts, especially at the start of treatment. It seems paradoxical taking medication to feel better, but potentially feeling worse initially.
It is. While antidepressants are intended to help,
Yes.
some individuals, especially early on,
Right.
might experience an increase in suicidal thoughts.
Okay.
This highlights the importance of open communication with your doctor
Right.
and emphasizes that medication is only one piece of a comprehensive treatment plan.
That makes sense. You also mentioned earlier that children and adolescents are more susceptible to certain side effects.
Right.
What about discontinuation syndrome?
Yeah.
That sounds kind of scary.
Discontinuation syndrome is essentially what happens when you stop Zytomil abruptly.
Oh.
It can lead to a bunch of unpleasant withdrawal effects.
Right.
Because your brain needs time to adjust.
So no going cold turkey. You need to taper off gradually under a doctor's supervision.
Exactly. And speaking of needing a doctor's guidance,
Yeah.
the briefing document points out several medical conditions where extra caution is needed with Zytomil. We're talking about things like heart problems, liver or kidney impairment, epilepsy, diabetes, mania, glaucoma,
Wow.
and even low sodium levels.
That's a lot to keep track of.
It is.
It sounds like you really need to be upfront with your doctor about your entire medical history
You do.
before even considering Zytomil.
Full transparency is essential for your doctor to make the best decision for your health.
Okay, any other red flags people should be aware of?
Well, the sources mentioned that Zytomil can increase the risk of bleeding,
Okay.
particularly if you're on blood thinners,
Yeah.
or have a history of bleeding disorders.
Right.
And they also highlight the potential for something called serotonin syndrome, which can happen if you mix Zytomil with other serotonergic drugs medications that also increase serotonin levels.
Okay.
This is where understanding the concept of polypharmacy, taking multiple medications, becomes really important.
I can see how that could get complicated.
It can. Serotonin syndrome is like an overload of serotonin in the brain.
Right.
And it can lead to a cascade of symptoms: agitation, confusion, rapid heart rate, sweating, muscle twitching,
Okay.
even seizures in severe cases.
So basically, it's crucial to tell your doctor about every medication and supplement you're taking, even over-the-counter ones,
Right.
to avoid potentially dangerous combinations.
Exactly. And one more thing.
Yeah.
The sources point out that elderly patients,
Okay.
those 50 and over, have an increased risk of bone fractures while taking Zytomil.
Another unexpected side effect to be aware of.
It is.
It seems like there's so many things to consider.
There are. It emphasizes the complexity of the human body
Yeah.
and how medications can interact with pre-existing conditions.
Right.
But don't worry, we'll unpack all of this information together.
Okay. Let's move on from the scary stuff to something everyone wants to know about: side effects.
Oh, yeah.
What did the sources say about the good, the bad, and the uncomfortable?
Well, the good news is that most side effects are manageable. The leaflet conveniently categorizes them by how common they are.
Honestly, the side effects section always makes me a little nervous when I read these leaflets. What stood out to you?
The most frequent ones are sleep disturbances.
Okay.
Things like insomnia or vivid dreams, changes in appetite and weight,
Right.
nausea, constipation, or diarrhea.
Not exactly a party in your stomach.
Right.
Okay.
You might also experience dizziness, drowsiness,
Yeah.
and unfortunately, sexual side effects are also fairly common.
Okay, so that's the bad and the uncomfortable.
Right.
But are there any serious side effects people need to watch out for?
Yeah.
Anything that would warrant an immediate call to the doctor?
Absolutely.
Okay.
The leaflet lists several serious side effects that require urgent medical attention.
Right.
For instance, swelling of the face, lips, or throat
Yeah.
could indicate an allergic reaction.
Right.
Easy bruising or bleeding, seizures,
Mm-hmm.
symptoms of serotonin syndrome, which we talked about earlier, heart rhythm problems, gastrointestinal bleeding,
Okay.
and difficulty urinating are all red flags that require immediate medical attention.
It's a lot to keep track of, but better to be safe than sorry, right?
I couldn't agree more.
It's always best to err on the side of caution when it comes to your health.
For sure.
All right, so let's say someone is prescribed Zytomil and they're aware of all these warnings and potential side effects.
Yeah.
What about the dosage and how to take it?
Sure.
Any key details there?
The leaflet mentions various dosages depending on the condition being treated,
Okay.
but it can't be stressed enough. Never self-medicate.
Right.
Your doctor will determine the best dosage for you
Right.
based on your individual needs and medical history.
Definitely leave the prescribing to the pros. We're just armchair experts here.
Exactly.
Right.
A couple other quick points from the sources.
Okay.
You can take Zytomil with or without food.
All right.
And don't stop taking it abruptly.
Right.
Remember those withdrawal symptoms we talked about? Yeah. Tapering off gradually under a doctor's supervision is key.
For sure. Speaking of things not to mix, the leaflet mentions a whole bunch of drug interactions.
Yeah.
It's like navigating a minefield.
It can be, yes. Zytomil can interact with a surprisingly wide range of other medications,
Okay.
including other antidepressants, certain painkillers,
Right.
even some herbal remedies like St. John's wort.
So the takeaway here is to be brutally honest with your doctor about all medications and supplements you're taking, right?
Absolutely.
No secrets from your doctor.
Even something that seems harmless, like an over-the-counter pain reliever
Right.
or an herbal supplement, could interact with Zytomil in a way that's detrimental to your health.
Yeah. Okay.
Yeah.
Got it.
Uh-huh.
All right. So we spent a lot of time talking about the risks and the precautions with Zytomil. But what about the potential benefits?
Right.
Why do doctors prescribe it in the first place?
Well, remember how we talked about serotonin being that mood messenger?
Well, imagine someone, let's call her Sarah,
Okay.
who's struggling with social anxiety. Her brain might not be sending those feel-good messages efficiently.
Okay.
And that's where Zytomil comes in.
Okay.
It can help boost those signals.
So it's not just masking the problem, but actually helping her brain function better?
Exactly. By increasing serotonin levels,
Okay.
Zytomil can improve mood,
Right.
reduce anxiety,
Huh.
and even help control obsessive thoughts and behaviors.
Okay.
For many people, it can significantly improve their quality of life.
That makes sense.
Yeah.
But I'm curious, wouldn't therapy or lifestyle changes, like exercise and meditation, be a better approach?
Right.
I know you can't give medical advice, but what do the sources say about those options?
You're right. I can't give medical advice.
Right.
But the sources actually emphasize that medication should be part of a holistic treatment plan.
Okay.
They don't dismiss those other approaches at all.
So It's not a case of either, but rather a combination of approaches.
Precisely.
Therapy can equip Sarah with coping skills and address underlying issues, while lifestyle changes can support her overall well-being.
Right.
Medication like Zytomil can help manage her symptoms and make it easier for her to engage in therapy and make those positive lifestyle changes.
It's like attacking the problem from all angles.
Exactly. It's about finding the right combination of tools for each individual.
Okay.
What works for one person might not work for another. That's why working closely with a doctor is so important.
Okay, so let's say Sarah is considering Zytomil, but is also exploring other antidepressant options.
Okay.
How does Zytomil compare to other medications out there?
That's where things get a little nuanced.
Okay.
There are many different types of antidepressants, each with its own way of working and potential side effects.
Yeah.
It's impossible to say definitively which one is best.
Right.
Because it truly depends on the individual.
It's not like a ranking system with one antidepressant coming out on top.
Not at all. It's more about finding the medication that best matches your specific needs.
Right.
And your body's unique chemistry.
So what are some factors a doctor might consider when choosing an antidepressant for someone like Sarah?
They'll look at her diagnosis, of course.
Okay.
Some medications are better suited for certain conditions.
Yeah.
They'll also consider her medical history, any other medications she's taking.
Right.
And her potential risk for side effects. It's really a personalized approach.
It sounds like a lot goes into finding the right fit.
It does.
Are there any specific advantages that Zytomil might have over other SSRIs?
Well, based on my understanding and what I've seen in the research, Zytomil is generally well tolerated.
Okay.
And tends to have a lower risk of certain side effects compared to some other SSRIs.
Okay.
For example, it might be less likely to cause weight gain
or
sexual dysfunction, which can be major concerns for some people.
That's good to know. I remember those were listed as potential side effects, so it's helpful to know that Zytomil might have a lower risk compared to some other options.
Yeah.
But even if Zytomil seems like a good fit, how long does it usually take to see results?
Oh.
Is there an instant mood boost?
Oh, I wish it were that easy.
Right.
Unfortunately, antidepressants don't work overnight.
Okay.
The sources emphasize that it typically takes several weeks, sometimes even a couple of months, to experience the full effects.
I'm so impatient when it comes to things like that. I always want to see results right away.
I know.
Right. But I guess patience is key here.
It really is.
Yeah.
And it's important for Sarah or anyone starting a new medication to understand that it's a process.
Okay.
They need to give the medication time to work and communicate openly with their doctor about any concerns or side effects they're experiencing.
What if someone's been taking Zytomil for a while?
Yeah.
And they're not seeing any improvement? What happens then?
That's a valid concern.
Yeah.
The sources suggest that if you haven't noticed any positive changes after a few weeks, it's crucial to talk to your doctor.
Okay.
They might adjust the dosage or recommend a different medication altogether.
Okay.
It's not a set it and forget it kind of thing.
It seems like the sources really emphasize the importance of the doctor-patient relationship throughout this entire journey.
Absolutely. Zytomil, like any medication, is a tool that can be helpful when used appropriately and under the guidance of a qualified healthcare professional. Open communication is essential.
Speaking of guidance, something that stood out to me in the sources was the emphasis on the psychological aspects of these conditions. It's not just about brain chemistry, right?
You're right. It's refreshing to see that the sources acknowledge that depression, anxiety, and OCD are complex conditions with both biological and psychological components.
So medication alone might not be enough to address the root causes.
Exactly. That's why they highlight the importance of therapy and lifestyle changes in conjunction with medication.
Okay.
It's about addressing the whole person.
Right.
Not just the symptoms.
That makes a lot of sense.
Yeah.
It's a much more holistic approach.
It is.
So we've covered the potential benefits, the importance of a personalized approach, the need for patience and open communication with your doctor.
Right.
What else should our listener keep in mind as we wrap up part 2 of our Zytomil deep dive?
There's one crucial point I want to reemphasize. Zytomil is a prescription medication for a reason.
Okay.
It's not something to be taken lightly or shared with others.
Absolutely. Sharing medication is never a good idea, no matter how well-intentioned you might be.
Exactly. Mental health is a complex and personal journey.
Right.
And What works for one person
Yeah.
might not work for another.
Mm.
It's vital to seek professional guidance
Right.
and make informed decisions based on your individual needs and circumstances.
Couldn't have said it better myself. Okay, time to get into the nitty-gritty
Uh-huh.
of how Zytomil actually works in the brain.
Okay.
I feel like we're about to crack a secret code.
It does feel that way. And
Yeah.
what's really fascinating is that even though SSRIs like Zytomil have been around for decades,
Mm-hmm.
scientists are still unraveling
Yeah.
the full complexity of how they work.
So we know the basics, but there's still a lot we don't know.
Exactly. Think of it like this.
Okay.
Imagine the brain as a vast,
Mm-hmm.
intricate network of roads and highways.
Okay.
We've mapped out some of the major routes,
Right.
but there's still back roads and hidden pathways to be discovered.
I love the analogy.
Yeah.
But let's get back to Zytomil.
Okay.
In the simplest terms, how does it actually work?
Well, remember our mood messenger, serotonin.
Yeah.
It travels between nerve cells in the brain,
Right.
carrying signals that affect everything from our emotions to our sleep cycles.
Right. We talked about that earlier.
Normally, after serotonin delivers its message,
Mm-hmm.
it gets reabsorbed back into the nerve cells that released it.
Okay.
It's like a recycling system for brain chemicals.
Right.
But here's where Zytomil comes in.
Okay.
It blocks that reabsorption process.
So the serotonin just hangs out in the space between nerve cells for longer.
Precisely.
Okay.
And by increasing the amount of serotonin in that space,
Mm-hmm.
it essentially amplifies the serotonin signal,
Okay.
making it louder and clearer.
So more serotonin, happier brain.
Yeah.
That's the simple version?
That's the gist of it, but of course it's much more complex than that.
Right.
We're still learning about all the ways serotonin interacts with other brain chemicals and pathways.
It makes her wonder, how did scientists even figure out that tinkering with serotonin reuptake
Right.
could have such a big impact on mood and behavior?
It's a real testament to scientific curiosity and persistence.
Right.
It took decades of research, beginning with the discovery of serotonin back in the 1940s.
Yeah.
Then in the 60s and 70s,
Mm-hmm.
researchers began to understand the role of serotonin in mental health conditions like depression.
And that eventually led to the development of SSRIs.
Exactly.
Wow.
It was a huge leap forward in the treatment of mental illness.
Right.
And while SSRIs aren't perfect, they've helped millions of people manage their conditions and lead more fulfilling lives.
It's really incredible when you think about it, how scientific discoveries can have such a profound impact on people's lives.
It really is, and it underscores the fact that science is a journey, not a destination.
Right.
There's always more to learn
Yeah,
and new discoveries to be made.
for sure.
Okay.
Well, that brings us to the end of our deep dive into Zytomil.
Yeah.
We've covered a lot of ground from what it is
Yeah.
and how it works to potential risks and benefits.
Yeah.
It's been quite a journey.
It has, and I think we've accomplished our mission of breaking down complex medical information
Right.
into clear takeaways for our listener.
I hope so. Remember, though, we've only scratched the surface here.
Right.
As always, it's crucial to read the patient information leaflet thoroughly
Yes.
and have a detailed conversation with your doctor.
Right.
They can help you make the most informed decision for your individual needs.
Couldn't agree more.
As we were exploring these sources, one question kept coming up for me that wasn't really addressed.
Okay.
How much do our individual differences, like our brain chemistry and genetics, play a role in how we respond to a medication like Zytomil?
Right.
It's fascinating to think about why it works so well for some people
Right.
and not so well for others.
Yeah, that is a really interesting question.
It is.
And, it's something researchers are actively investigating.
It definitely gives us something to ponder, right?
It does.
And on that note, we'll leave you to your thoughts.
Okay.
Thanks for joining us on this deep dive into the world of Zytomil.